My name is Diann Callahan. I have 2 children and 3 grandchildren. My grandchildren keep me extremely active. We do a lot of hiking and skiing. That's our main thing in the winter. When I skied, I would have to ice and take ibuprofen afterwards because of the pain in my knee. And then when it became debilitating is when I came to see Dr. Johnson and his staff.
So when Diann and I first met, she had come back from a skiing trip. She was having quite a bit of pain in her knee that had been ongoing for months. Initially, we tried the conservative treatments, injections, physical therapy, medications. And then when those things failed to provide lasting relief, we talked about knee replacement surgery.
I had so much confidence in Dr. Johnson and his staff that I didn't really have much fear about it at all. They were very clear in explaining the surgery.
Robotic knee replacement has really changed my practice as a hip and knee replacement surgeon. It's a way for us to give patients a more personalized knee replacement that functions more like their native knee. We map out the articular surface of the knee on the inside and then test how stretchy the inside and the outside ligaments are. That then creates a 3D model of the knee on the computer. On that model, with the software, we can adjust the components so that they fit her specifically and function in a way that her native knee should function. And then we use the robot assistants to put the implants in that position.
All the new technology and approach has reduced the length of stay being here in the hospital and of course reduced the time of recovery.
She went home the same day. I saw her at 2 weeks for her post-operative appointment. She had near full range of motion. It's very rewarding for me to be able to give somebody their lifestyle back and the things that they enjoy back.
If I couldn't live the life that I am now, I'd be missing out a lot with my grandchildren. I'm looking forward to this year because I feel like I'm 100% again. That was life-changing for me, to have that pain go away and to be able to live the life that I want to live.